Welcome to the Common Challenges and Misconceptions section of the Behavior Functions Basics module. This is where we learn how to understand behavior functions as they can be tricky. We're going to explore them over the next few minutes. One of the most common mistakes is assuming that every behavior has a single fixed purpose. For example, when a child screams, it could be to escape a task, or it might be to get attention. In some cases, it could even be both. This is why it is important to use ABC data, which stands for antecedent, behavior, and consequence. And this is to determine the true function of the behavior and not just rely on assumptions. Now, let's take a closer look at how one behavior can serve more than just one function, depending on the context. In this example, a child screams during a task. Now, the challenge here is determining the function. Is the behavior happening to avoid the task or to gain attention from an adult nearby? And this is why it is so important not to jump to conclusions. Instead, we need to rely on observation. What happens before and after the behavior? By using ABC data, we can gather clues and make more accurate decisions when designing our interventions or implementing them. And then one of the most common misconceptions that we hear in ABA is labeling every unclear behavior as sensory. Just because we don't yet know what the function of a behavior is, it doesn't mean it must be sensory by default. For a behavior to truly be classified as sensory, it must be both repetitive and observable. This means it must occur in a consistent, patterned way. And we have to actually see it happening, not just assume it based on a hunch. So being accurate in how we label behavior ensures that we select the right interventions and do not accidentally reinforce the wrong function. Let's talk about the setting. When we are identifying the function of a behavior, it is very easy to confuse the setting events with the actual cause. For example, if a child is hungry, tired, or overstimulated by a noise, those conditions can increase the likelihood of the behavior occurring, but they are not a function. These are known as setting events, factors that set the stage for behavior but don't explain why it actually happens. So to get the actual function, we still need to observe what happens before and after the behavior to be informed. So remember, setting events matter, but they're not the same as function. And here we have an important distinction. Behavior does not equal diagnosis. So just because an individual has a diagnosis like autism, it does not automatically mean that a behavior is sensory in nature. That assumption can lead to incorrect intervention strategies. Instead, we must understand that behavior is to be analyzed objectively through ABC data, which is what happens before and after the behavior. You're going to hear this throughout the whole course. Remember that it is a data that tells us the function of the behavior and not the diagnosis. Now let's talk about tangible versus attention. When a child cries and receives both a device and adult interaction, it can be tricky to pinpoint what the actual function of the behavior is. Was the behavior driven by a desire for the tangible item, the device, or was it to gain attention from the adult? This is where careful observation matters. So the key here is to look at which consequence actually reinforces the behavior over time. If the behavior continues to happen right before getting the device, the likely function is tangible. If it occurs when the adult reacts or speaks, attention might be the stronger reinforcer. So in a real world setting, behavior can be maintained by multiple functions, and this is a great example. A common mistake in applied behavior analysis and in RBT sessions is assuming that certain behaviors, like aggression, automatically serve one function, such as escape. But behavior function is not based on what the behavior looks like, it is based on what the behavior achieves, and that's the key to remember. For example, two children might show the same behavior, such as yelling, but one does it to avoid a task, while the other does it to gain attention. So you must always look at the consequence of the behavior, which is what happened immediately after it occurred. And that's going to tell you more than how intense or loud the behavior appeared. When we analyze behavior, it is important not to overlook reinforcement history. Past reinforcement, even if it was inconsistent or unintentional, can shape current behavior. For example, if a child has gotten out of tasks by crying in the past, that crying is more likely to continue, even if we no longer respond to it. Behavior doesn't exist in a vacuum, so what has been reinforced before matters now. If we skip this step, we risk misidentifying the function that we're applying the wrong intervention. As an RBT, remember that your job is to observe, record, and analyze the data. That's how we avoid misinterpreting the behavior and ultimately how we create better interventions. Go on and click next to begin your interactive drag and drop activity.